In this video, we're going to talk specifically about some of the behaviors most dangerous to health that people engage in and how to reduce harm in these areas. First, there's smoking. We all know by now that smoking is one of the worst things you can do for your physical health. But quitting smoking works differently for different people. Some people are able to quit cold turkey, but for most people, it can take aids to successfully quit, and you may need to try many times in order to be fully successful. If you would like to stop smoking, there's an organization that you can call that will send you patches that will help you to stop and will provide other types of support. Visit them at www.nobuts.org. CVS provides smoking cessation aids for less money than other pharmacies. There are support groups that can be helpful to some people. Others have also successfully used vape pens to wean themselves off of the level of nicotine that they are using. Exercise can be really helpful too. Some people who begin to exercise strenuously no longer even want to smoke as their fitness levels increase. A lot of times you need to find some healthier physical habit to replace the unhealthy one, but the actual physical dependence on nicotine only lasts for days. Next, let's talk about sexual practices. STDs are infectious diseases that are most often spread by sexual intercourse. They can be spread through oral, vaginal, or anal sex. Some are also spread through contact with blood. Your chance of being infected are increased drastically if you don't use a condom during sex. In the U.S., there are 19 million STD diagnoses every year. You won't necessarily have symptoms if you are infected. Because of this, the only way to know for sure if you have an infection is to get tested. If you are having sex regularly with new partners, it is important that you get tested regularly too. Some of the ways that you can prevent getting STDs or passing on STDs are restricting the number of sexual partners that you have, always using a condom during sex, and getting tested regularly. The most common STDs are herpes 1 and 2, which can cause blisters on and around your mouth or genitals. HPV, which can cause genital warts and some types of which can increase chances for cervical or penis cancer. There is a vaccine for HPV that you can ask for at the doctor. HIV, which weakens your immune system, can progress to become AIDS. Symptoms include swollen lymph nodes, tiredness, sweats, and weight loss. If untreated, it can lead to death. Chlamydia often doesn't have any symptoms, but when it does, they include discharge, bleeding, pain, or burning. Thrush, which is an advanced yeast infection. Syphilis, which occurs in 3 stages and includes a sore or sores followed by a rash and muscle cramps or hair loss, warts, fever, or weight loss. If untreated, the infection can progress to paralysis, memory loss, deafness, damage to vital organs, and death. Gonorrhea, also called the clap, which often doesn't have any symptoms, but when it does, they include discharge, pain, or bleeding. Some of these infections have been relatively easily treated with antibiotics in the past, but new strains have developed in the last several years that are resistant to these drugs. It is important to be tested for these infections regularly if you have sex with new partners regularly. Another important blood-borne pathogen to be aware of is hepatitis. Hepatitis is an infection that can mess up your liver and make any effects of the use of drugs or alcohol to it a lot worse. Your liver does a lot to keep you healthy. It stores the nutrients from your food. It makes substances that your body needs. It breaks down alcohol or poison and gets rid of waste products. If your liver gets sick, it's like when a garbage disposal stops working and things get backed up. Hepatitis affects your liver and is transmittable to others. Hepatitis is statistically more common for people who have been incarcerated. You need to be tested to see if you have it because you need to take steps to keep from giving it to others and because there are treatments that will keep it from getting worse. There are 3 types of hepatitis: A, B, and C. Hepatitis A can spread through food or water. Hepatitis B can be spread through saliva, blood, or sexual contact. Both of these can cause flu-like symptoms, or they may not result in any symptoms at all. Hepatitis B can become chronic, meaning it doesn't go away. Hepatitis C is spread by direct contact with blood. It is often spread by needles or unprotected sex. This hepatitis often becomes chronic without treatment. It can also lead to liver failure or liver cancer. Because of this, it is important to get tested if you have come into contact with blood or had unprotected sex. To prevent getting one of the forms of hepatitis, you should avoid unprotected sex and any contact with blood. In particular, do not share needles during drug use or when getting a tattoo. Don't share personal items that may have other people's blood on them, like razors. Use condoms when you have sex. You can also get a vaccination for hepatitis A and hepatitis B. If you have hepatitis C, it is important that you get treatment for it so that it doesn't become chronic. After you get tested, you should consult your doctor about treatment to protect your liver. You will also need to stop drinking alcohol. Finally, let's talk about your health care and making sure that you get the screenings you need. When you get out, you're often afflicted with pains and ailments that you developed while you were incarcerated that didn't get treated the right way. It is very important that you get to a doctor as soon as possible to start getting the treatment that you need. You should get health coverage first, then get a doctor. Make a list of all the problems that you've been dealing with and visit the doctor with that list. You should make sure that the doctor knows everything that you are dealing with. It can be helpful to take a friend or family member with you as well to make sure that you are sharing everything that you need to share and hearing everything correctly. Let's talk about the steps to take. Call the number on your health coverage card. Ask for a primary care provider. Call the doctor to set up a visit to get an annual exam. Ask them to make sure that they're still accepting your type of health coverage. Schedule the exam. Write down the date and time and make sure to keep this appointment. Take a trusted person with you to your exam. Take your list of questions and problems with you into the exam room and make sure to tell them everything. Doctors are often very busy and have a lot of patients, leading to the time with each patient being very short, frequently less than 10 minutes. Because of this, you may need to be firm in asking all the questions you need to ask. If you are feeling that they are discriminatory in any way, you can find a different doctor who will provide good care. It is okay to try to find a doctor you're comfortable with if you are able to do so. Make sure that you ask them to administer a full panel for transmittable or infectious diseases, cancer screenings, blood tests for cholesterol and or heart health screenings, screenings for diabetes, gynecological exams if applicable. We've covered many of the practices that will help to keep you safe. If you have questions or concerns, make sure to follow up and ask someone you trust. Be proactive in learning more and making sure that you look after yourself, particularly in this exciting and stressful transitional time where suddenly all of the old temptations or habits are available to you again. Thanks for watching and take care of yourself.